Okay. Morning, everybody. So today we're going to go over our MDI board again and talk about how we're going to better manage our daily improvement. So, in looking back at the past, from July to August, we've done exceptional. We've jumped. We were in the 25% range of being within compliance in order to check our, make sure that our bed alarms are plugged in on our patients, and we've jumped up to 93% for August, which is awesome. So this month so far, we had a few days where we missed some data, but so far we've been 100% to 90%, which is great. So please just remember, even if your patient is not on fall precautions, we need to still make sure that the cord is plugged from the bed to the wall for safety, okay? So great job there. Second, daily weights. We've had a couple of instances where we've fallen out this month. However, if you look from July to August, again, we've jumped great. We went up into the 83 percentile, which is wonderful. A couple of days that we have fallen out here. Can somebody maybe give me a reason why maybe a daily weight might not have been completed? I'll give one instance. I'm sorry?
Maybe the bed didn't get zero?
Possibly. Sometimes it's a new transfer that's happened at change of shift. So just remember, it is a 24-hour responsibility, so maybe night shift didn't pass it along to you as a tech, or maybe the night shift nurse forgot to tell you as well. But ultimately, it's everyone's responsibility. So daily weights on everybody every single day. We never want an estimated weight in there. It's very detrimental to pharmacy and the patient's treatment regimen, okay? Next one, managing daily improvements for daily I's and O's. So we have day shift and night shift. Again, we've jumped up tremendous, so good job. We went from 13% to 79% for the month of August. So we had a few fallouts so far this month. We're doing much better. We only had one day where we were in the red for night shift. So some of the issues we've had here, maybe the patient didn't have any oral intake because they were a feeder. Somebody got busy and they fed the patient but didn't chart it. Or maybe the patient was independent and forgot to tell you how much. So just remember, you need to prod that patient and ask them, how much did you drink today? Or sometimes the nurses help the techs and vice versa, and we take the trays and we don't tell the techs. So please just remember to communicate to each other. That way it's properly documented. Okay, leadership rounding, we're doing great in the 81 percentile rank. So that's making sure that our charge nurses and myself are visiting on the patients and they are recognizing that leadership was in the room. Readmissions, we haven't had any this month. We did have 2 in August. So some of the reasons for that is patient refusing home health. Also, patient does not want to go to a SNF. They need further care. They're unable to come get the treatment they need, and they come back within 30 days. So again, in MDR rounds, we're just going to address that every day. Discharge planning, what can we do to try and prevent the patient from coming back? Sometimes we don't have control over that, but that's why we're doing our rounds every day to talk about that. And then length of stay. So August, we met our target about 58% of the time, meaning that patients 58% of the time were within 5 days or less. We want to be under 5 for the most part. So we were setting around 4.9 as an average for the whole hospital. A couple of issues why we are not meeting our target length of stay. Patient condition change. So they come in for vomiting and then we find a lung mass. So they're here a couple more days because we have to biopsy it. Other couple things, there's no discharge plan, just like in our length of stay issue. Patient needs SNF placement, but they're unfunded. So, does anybody have any questions? Okay, good job, team.
Thank you.
Cut.